Hey everyone, welcome back for another deep dive. Today we're going to be looking at something pretty interesting. We're looking at fencing and breast cancer recovery. Here at Fencing Family, we all know and love fencing for its athleticism and the strategy involved, and the camaraderie. But what if fencing could also be a tool for healing and empowerment?
Yeah, that's what researchers are exploring with this program called RIPOSTE. It stands for Reconstruction Self-Image Posture Oncology, Sante, Health Therapy, Escrime Fencing. And basically, it uses adapted fencing to help breast cancer patients regain their strength, mobility, and confidence after they've had surgery.
So I'm curious about this, like why fencing? It seems like
Uh-huh.
such a specific and, dare I say, elegant sport. What makes it so well suited for this group of patients?
Well, I mean, if you think about it, a lot of breast cancer patients face different challenges after surgery, like pain, limited range of motion, particularly in the upper body. And of course, there's the emotional toll of the whole experience. Adapted fencing kind of directly addresses these issues.
So it's not just about like getting back in shape. It's really about addressing the specific needs of someone recovering from breast cancer surgery.
Exactly. And they even use the saber, which is the lightest weapon, but it's not just about the weight. The target area in saber fencing is above the belt. And a lot of the movements, like the high parries and the attacks, really encourage shoulder and arm mobility, which is exactly what these patients need.
That's so smart. I mean,
Yeah.
it's like they really thought about the details of the sport and how to adapt it. Even the attire,
Yeah.
can help patients feel more comfortable, more confident during exercise,
Yeah.
especially if they're self-conscious about the visible signs of treatment.
Yeah, exactly. And that lets them focus on, just the movement and their recovery.
So it's like creating this safe space to reconnect with their bodies. But how do we know if this program actually works?
Well, that's where the Ripostke trial comes in. It's a randomized controlled trial. And that means patients are randomly assigned to either start fencing immediately after surgery or they start 3 months later.
Oh, so they can compare the effects of early intervention versus starting a little bit later in the recovery.
Yeah.
Okay, and what are they actually measuring to see if it's effective?
The main outcome they're looking at is the change in quality of life scores, and
Yeah.
they use standardized questionnaires for that. But they're also looking at these secondary outcomes, like, are there changes in levels of reported disability, fatigue, anxiety, and depression?
So they're really trying to get a holistic picture of like not just the physical improvements, but like how it affects them mentally and emotionally.
Exactly. And they use a combination of these standardized questionnaires, but they also do qualitative interviews to really capture the nuances of how fencing affects their lives.
Can you give us an example of like what these questionnaires measure and like why that's important?
Sure. So one of the questionnaires they use is called the DASH. It stands for Disabilities of the Arm, Shoulder, and Hand. And this is really relevant because it measures upper extremity function, which is often impacted by breast cancer surgery and treatment.
So it's not just like how they feel overall,
Mm.
but it's also concretely measuring how their physical function is improving,
Mm-hmm.
especially in areas that are most affected by their condition.
Exactly. And then the qualitative interviews kind of add another layer of understanding because patients can share their personal experiences in their own words. How did fencing make them feel emotionally? Does it impact their self-image? Did it help them connect with others? These are all important aspects of recovery that might not be captured just by questionnaires.
So it's like combining the objective measurements with their personal stories to get a more complete picture.
Yeah, it's a powerful approach. And the initial findings, even though they are based on a small sample size, are really encouraging.
That's awesome. And it
Yeah.
makes you wonder, what other creative approaches could we be using to help people thrive after they've, gone through such a challenging experience?
For sure. And, speaking of supporting well-being, I want to take a second to mention a company that really embodies the spirit of the fencing community, Fencing Family.
Yes, absolutely. Fencing Family is an Etsy shop, and it's based right here in Los Angeles.
Mhm.
And they get it. They understand the passion and the dedication and the joy of fencing. And they have the most amazing apparel and accessories that let you show your love for the sport on and off the strip.
Their products are so comfortable and stylish, and I've seen fencers of all levels wearing their gear.
If you are looking to express your fencing pride, you have to go to fencingfamily.etsy.com and check out their collection. You will not be disappointed. Now back to the RIPOSTE program.
One of the things that really stood out to me in this research is like how much they emphasize the psychological and social benefits of adapted fencing. I mean, we've talked about the physical stuff, but, what about the emotional impact on the patients?
Yeah, that's a really good point. Breast cancer treatment can really affect a person's body image and self-esteem. You've got surgery, radiation. All
Mm.
these therapies can lead to visible changes, and that can be really tough to deal with emotionally.
Absolutely. And that's where something like fencing can be so powerful. It's helping patients reconnect with their bodies in this really positive way, rebuilding strength and confidence, rediscovering a sense of control.
So it's not just physical rehab, but also about, reclaiming that sense of self after going through something so challenging.
Exactly. And don't forget about the mental challenge of fencing, too. The strategy, the focus, having to outthink your opponent. It's a mental workout as much as it is physical.
Right. It shifts the focus from being a patient to being an athlete,
Yeah.
someone who's strong and capable. I bet that can be a huge boost to their self-esteem.
It can be transformative. And then on top of that, there's the social aspect. Participating in a group activity like this, you have those opportunities for connection and support. You can connect with other people who really get what you're going through, share experiences, build camaraderie. It's like a built-in support system.
That's so important, especially when they might be feeling isolated or overwhelmed, feeling like you're part of a community, a team that can make all the difference. It reminds me of like going to my fencing club and connecting with my fellow fencers. It's more than just a sport. It really is a community.
Exactly. And that sense of belonging, that shared purpose can be so healing.
So we've talked about the RIPOSTE program and the research, but are there any limitations to the study that we should be aware of?
Well, the main limitation that they talk about in the research is the sample size.
Yeah.
It's pretty small. So the findings, while promising, they need to be confirmed by larger trials to see if these results hold true for a wider range of patients.
So more research is definitely needed, but the initial results are pretty interesting. It sounds like adapted fencing could be a really valuable tool for breast cancer recovery,
Mm.
addressing not just the physical, but the emotional and social aspects of healing as well.
Yeah, it's a holistic approach for sure. It recognizes that, these patients have complex needs
Hmm.
and it offers this unique and engaging way to support their journey back to, feeling whole.
It's really inspiring to see how sports and fencing especially can be adapted and used in such a meaningful way. It just shows you the resilience of the human spirit and our ability to find strength and healing in some pretty unexpected places.
Yeah.
Makes you wonder what other innovative approaches are out there or, things that could be developed to help people in their recovery journeys.
Yeah, it's a really exciting area of research. I mean, we're seeing more and more research on that mind-body connection and
Mhm.
how things like exercise, mindfulness, social support play a role in healing.
It's not just about treating the physical symptoms of a disease,
Right.
but looking at the whole person, their emotional well-being,
Yeah.
their social well-being.
Exactly. Recognizing that true healing goes beyond just the physical stuff.
Well, this deep dive has definitely given me a lot to think about. It's amazing how something like fencing, which we usually think of as competition athleticism, can be such a powerful tool for recovery and empowerment.
It really speaks to how adaptable the sport is and how dedicated people are to finding these creative ways to use it to really make a positive impact.
And for our listeners who are feeling inspired, remember you can always show your love for the sport with some awesome gear from Fencing Family.
Absolutely. Their apparel and accessories are a great way to show your fencing pride and support a small business that really gets the fencing community.
You can find them on Etsy at fencingfamily.etsy.com. They've got something for everyone, whether you're a seasoned competitor or just starting out.
And you never know, maybe one day we'll see these adapted fencing programs like Repos becoming more widely available and helping even more people rediscover their strength and their joy through fencing.
That's a great thought. Well, on that note, we'll wrap up this deep dive. A huge thank you to our expert for joining us and sharing all these insights.
It was my pleasure.
And to all of you listening, thank you for joining us on this exploration of adapted fencing and its potential for breast cancer recovery. Until next time, keep exploring, keep learning, and keep those blades sharp.